and welcome to National Focus. I'm your presenter Mervin. Thank you for joining us. In the headlines, 23 trained in conversation maps education tools for diabetics. More students attend the Ross University School of Medicine, and we will bring you a report from Tanya Green on efforts to manage the black sigatoka disease. Stay tuned as we bring you details of these and other stories when National Focus returns. Welcome back. Time now for the details of the news. The Ministry of Health, in collaboration with the Dominica Diabetes Association and the Rotary Club, hosted a workshop on Thursday for conversation maps educational tools for diabetics. The workshop was held at the conference room of the Windsor Park Sports Stadium and was hosted by Dr. Maxine Swin of Guyana.
You as facilitators don't have to lecture to your patients. You use the map as it will unfold, you'll see what it is, and you'll guide your patients in a conversation. They learn from each other. At the end of a session, their knowledge would have improved.
Dr. Swain, in her opening remarks, noted that conversation maps are essential in educating diabetic patients about their health conditions.
They will begin to understand and take care of themselves and live a normal life. Because you have diabetes don't mean you have to sit in a chair or lie in a bed. Unfortunately, when you don't take the care, it brings its own complications. People lose their limbs. They have expensive renal failure. They may experience renal failure, which is expensive to rehabilitate. You need dialysis.
The president of the Dominica Diabetes Association, Mervin Birmingham, says the association recognizes the magnitude of the situation of diabetes among the Dominican population.
We also recognize that the number of people living with diabetes or at risk of developing diabetes and its complications is increasing. We appreciate the challenges of getting some individuals to acknowledge they have the diabetes because of the associated or perceived or real stigma and discrimination. The association understands the importance of prevention and self-management education in reversing the increasing trend in the prevalence and incidence of diabetes and other NCDs. And therefore, the Dominica Diabetes Association is of the firm view that unless people living with diabetes learn self-management skills, the risk of developing complications leading to premature deaths will continue to increase.
Director of Primary Healthcare, Dr. Martin Christmas, in his address at Thursday's workshop, spoke of the impact of diabetes on the Dominican society.
Persons in our society lose years and hours of useful work time and their life. Their families suffer. Some of these persons are actually the sole breadwinners. And we in the Ministry of Health really understand that the need to really fight against this comes from the point that we are focusing on prevention rather than cure. We would rather be, as we call healthcare providers, we want to really treat the healthy, keep them healthy, and not only treat the sick. However, when one becomes ill with this ailment, we do have to find means of making sure that you are able to fight it. And just having persons come into our clinics, the traditional therapeutic measures is not sufficient.
He believes Thursday's workshop on the conversation maps educational tools will complement the ongoing efforts to curb the incidence of diabetes and other chronic non-communicable diseases.
It allows us to explore new ways of speaking to the patients and getting them to understand that important concept of self-management, something that primary healthcare has been teaching for quite some time, the people-centered approach, and actually getting persons prepared and equipped to be able to manage their illness themselves with our assistance, of course. And this is a lot more effective given all limitations in terms of human resource. So I urge everyone here to make the best use of the experience and the opportunity to learn this new method of dealing with your patients and the persons who work with patients. Go out there and encourage your other colleagues to utilize a similar method.
In more news, the Ross University School of Medicine held a white coat ceremony at its annex building on Tuesday. The ceremony was held to welcome a new group of men and women who will begin studies in medicine at that institution. President of Dominica, His Excellency Dr. Nicholas Liverpool and Mrs. Liverpool, Prime Minister Honorable Roosevelt Skerritt attended Tuesday's ceremony. Parliamentary Representative for the Portsmouth constituency, Honorable Ian Douglas, welcomed the new medical students to Dominica.
As individuals, each of you is on a journey that will take you to a place where you can live a happy and fulfilling life in the service of your fellow men. All of Dominica embraces you in this quest, and it is our pleasure to continue working with the management of Ross University in creating an environment that is so absorbing and conducive to academic pursuit that you will not have the time to miss home.
Honorable Douglas says Ross University has achieved quite a lot since it began, and he is looking forward to improved relations with the university in the years ahead.
Today, Ross University School of Medicine holds the enviable distinction of being able to place more graduates into U.S. residencies than any other medical school in the world. It is fair to conclude that this outstanding achievement has as much to do with the quality of Ross's faculty and management as it has to do with the harmonious and mutually beneficial relationship that has existed between the government and people of Dominica and Ross University over those years.
Chancellor and Dean of the Ross University School of Medicine, Dr. Joseph Flaherty, delivered the keynote address.
This is a very, very serious moment in your life. You've heard the expression, it takes a village. Here, it takes a country. Where else in the world would you get the president and his wife and the prime minister, several other ministers, seriously attending, because this country is dedicated and committed to your education. Really are. And we thank them.
Dr. Flaherty said it was the mission of the institution and the students which attracted him to the university.
33 years, remarkable fidelity to one very important mission. Besides producing great doctors, one important mission, to give students an opportunity that might not otherwise have that opportunity to get a medical education, to succeed at it, and to become doctors and lead productive and useful lives. That is what Ross's dream is about. The other part of its dream is what is taking us and will take us a long time to do. And actually, Dr. Wales said it. We don't want to be just the largest, we want to be the best. We want outstanding academic excellence. Teaching is our only key mission.
The president of the Student Government Association, Michael Wallach, had some words of advice for the new students.
There will be mornings where you look at yourself in the mirror and you think, there's no way I can learn all this. You will have moments where, in days where you feel completely lost and everything is impossible. But let me tell you, there's nothing further from the truth. You will succeed. You will learn all this. And 1 year from now, the only thing you'll be thinking of is Michigan, Miami, or Roseau. And to make one last point, once a day, remember why you're here. Dr. Sasso also repeated this same remark. At some point along your journey, you may experience a setback. It may be a failing grade, maybe even a failing semester, but don't let it derail you from achieving your dream.
The management of the black sigatoka disease continues to receive attention by government and agriculture stakeholders here. On Thursday, a national stakeholder consultation was held at the Gary Hotel. Tanya Green was there and files this report.
5 regional countries, including Dominica, now affected by the black sigatoka disease, are in the process of putting together individual national plans, which will eventually form part of a regional integrated program to better manage the disease. Black sigatoka is a deadly disease caused by the leaf spot fungus affecting the leaves of the banana and plantain plants. Back in July 2012, the presence of the black sigatoka was confirmed on Dominica. Since then, a number of organizations have been working with the Ministry of Agriculture and affected farmers in the management of the disease.
The government has committed quite a bit of money to ensuring that disease does not devastate the banana and the plantain subsector. We have been very busy, and you'll hear a lot more about that. We have been very busy working with the farmers to de-leaf, to train them, build their capacity. So we've trained them to do better farm management. Importantly, farm management must be executed in a way that manages or reduces the level of inoculation, the level of spraying, and so the role of the farmer is very, very important.
Agricultural officials here, though encouraged by the amount of work done so far, is calling for an integrated approach in the management of the disease.
I must tell you that we've been very active in terms of the task force and the management committee, and then the staff of the plant quarantine, and then the coordinator. We've been very active, and in our interactions we have concluded very firmly that we have to take an integrated approach, a very integrated approach to the management of black sigatoka.
Stakeholders attending Thursday's national consultation at the Gallery Hotel have been advised to use the resources available to put effective plans for the successful management of the dreaded disease.
We are all aware of the critical importance of the banana and plantain sectors to our country, which is why I urge each of you present at this consultation to actively participate and contribute to the development of the strategic management plan for our implementation.
I ask you to put your best foot forward, use your knowledge to ensure, and you do have some of the best experts in that field here with you today. So put your best foot forward, use your knowledge to influence and to input into what will be a strategic plan for the management of black sigatoka.
Food and Agriculture Organization consultant Dr. Luis Vicente Perez from Cuba, who has years of experience working with the black sigatoka disease, is currently on island for 1 week. During his familiarization visit, he will interact with farmers and technical personnel within the ministry and provide them with suggestions on how the disease can be managed. Dr. Perez has advised that it cannot be business as usual. He says there needs to be a change in farm practices to include maintaining a strict schedule of fungicide application.
Black sigatoka is a huge problem. It's a huge problem, but it's a problem that can be defeated. We have been facing the problem for long ago, 20 years, but not only in Cuba, the whole Central America. And what we have done is to put together all the contribution of all scientists and very good scientists in the region, and elaborate a comprehensive, a holistic program of management of the disease. The problem is that the disease has a shorter cycle than the other sigatoka you have before. You have to do much more treatment than with yellow sigatoka. So we have spent a little time trying to precise when are conditions and when should be done treatment and when don't have to be done treatment in order to optimize or reduce the number of fungicide treatment in the banana plantation.
Dominica's action plan for the management of the black sigatoka is expected to be presented at a regional consultation to be held in Barbados later this month.
From here, Dr. Perez and I, we go to St. Lucia next week, and then the following week we have a regional workshop, a regional consultation in Barbados on the 20th and 21st of September. And 2 participants from each country would be present at this meeting, where we will discuss the national action plans for each country, as well as, and then distill out a regional action plan that can be implemented at the regional level. And from that, we would develop a draft proposal for resource mobilization.
Caribbean islands affected by the disease are optimistic that the regional integration plan will be ready for full implementation by January 2013. For National Focus, I am Tanya Green reporting.
Oh, many thanks to Tanya for that report. In other news, Minister for Employment, Industry and Trade, Honorable Dr. Colin McIntyre, has urged the National Development Foundation of Dominica to consider new ways of operations in order to cut costs. Speaking at the NDFD's 41st Annual General Meeting on Wednesday, the Trade Minister noted that with due consideration to the global financial crisis, every organization ought to reduce spending as much as possible.
What I'd like to urge the NDFD to do, and I'm sure you're looking at it right now, is to look at new ways of doing business. We are 30 years in the business right now. There are major challenges confronting the globe right now, and there have to be a new way of doing business in terms of how we can prepare ourselves and be better suited to serve our clients.
The Trade Minister mentioned that government will continue to minimize expenses as well, as it may take a while before any significant relief is felt.
We urge you to be very, very diligent in terms of the articulations of the government, Prime Minister, myself as well, in terms of, making sure that we try our best to cut spendings here, save. Just try it. You have to do something. It's not easy. The light at the tunnel is extremely dim still. I mean, we can see a faint ray coming across, but it's extremely dim. As a matter of fact, it has trickled down, and in small island developing states, you tend to see that latent effect, and we are feeling a little more of it. Lucky we made the changes then, which has helped us quite a bit.
In other news, in 2011, persistent rains associated with the passage of Tropical Storm Ophelia resulted in widespread flooding and left the communities of Massac, Maho, Campbell, St. Joseph, Chekol, and Benawavin severely damaged. Honorable Rayburn Blackmore spoke about the need for river walls during a recent interview. He says the people of these communities are still exposed to similar occurrences. However, a new dawn is coming for the people of his constituency and St. Joseph, as contracts to address the issue of river walls are before the Minister for Finance.
We know what transpired during the passage of Ophelia, when, of course, the people of Mao, Massac, Campbell, St. Joseph, and Chekol area and Benawavin were severely, the areas there were severely damaged, and they're still exposed to the possibility of a similar occurrence. I'm very happy that the contracts are now before Finance, and we're hoping to have the signing ceremony very soon, and I'm hoping to have that under the Mao market.
He says the construction for the river walls will be executed in phases.
What we have done, we have been able to segment the work and to adopt a community-based approach where most of the contractors will be coming from the Mao community, from Massac, and of course in St. Joseph area. And I'm happy that the Labour Party administration is able to address a long outstanding issue, because the issue, the rivers traverse the communities in Massac and Kinfield and Mao. That was so before I was born. That was so before the Prime Minister was born. But at the end of the day, we are not saying in the Labour Party that we're raising our hands in the air and saying that we inherited those shortcomings or the deficiencies, there's nothing we can do. What we're doing, we are able to identify the deficiencies, define them, and to embark on a proper system of intervention. And that is what the Labour Party administration is all about. And I'm happy to be part of this administration.
The government continues to create employment pathways for young people on the island. Honorable Dr. Colin McIntyre, who is Minister for Employment, is encouraging young men and women who have a particular interest or knack in any profession to identify themselves to the government.
All young men who, see there's something that you can do, something that you'd like to learn, let's approach the government, approach the small business support unit, approach the folks there and discuss with them, and we can develop the various modules to train them, give them a stipend and put them out there. And this is what we're talking about, the next level of Dominica.
He made the call during a recent interview where he spoke about government's recent initiative, the apprenticeship program. This is geared towards providing on-the-job training for young people.
When people visit here, what you see happening right now is a lot of folks who come to the Tito Gorge, they're saying, well, wow, they're seeing some serious stonework going on there. And they're wondering who is doing that. But I want to say to the people of Dominica, it's being done by our young men. And they have the ability and they're being taught to do it, and I think it's something that can go far for us in Dominica. We're not talking here of just basic stonework. We're talking about fine art stone masonry.
The National Development Foundation of Dominica is confident that since its inception in 1981, it has grown enough to handle bigger challenges. Speaking at the Foundation's 31st Annual General Meeting, Chairman of the NDFD, Dr. Damian Dublin, communicated his organization's willingness to take the operations to a higher stage.
We are ready. We can handle a 10 million, 15 million, 20 million facility easily. What we're saying is that probably over the years they have been watching NDFD as an organization dealing with micro businesses, and probably because you're dealing with micro businesses, people tend to view you as keeping within a small parameters. But we're saying after 40 years, what I've outlined there, the success and the impact we have had on the Dominican society, we're saying we're ready to handle a 10 million, 15 million, 20 million facility, which would help us to, as the famous term which is being used, take us to the next level.
Dr. Dublin said further that after 30 years of doing business, the Foundation can count enough successes to move away from solely micro businesses. He referenced the NDFD's 2011 report, which states that over $382 million in loans have been released into the economy to improve the lives of Dominicans. As part of the many achievements earned by the National Development Foundation, the chairman listed a few.
Other activities related to the year which the Board of Directors was involved in is a review of the loan and operations policy, which was effected. We are now in the final draft of these policies, review of the Articles of Association and the membership criteria. This is ongoing, the membership criteria, we need to get it locked down. The Articles of Association, we're trying to, because of the 40 years that it has been established, and when NDFD was established, it was primarily grant, so the whole focus was different. So we have to try to bring the Articles of Association in line with present realities, but at the same time maintaining the core principles of NDFD. So that's where the challenge is, to balance it and get a mix that's appropriate. For those who have come there recently, they'll see the front office looking real nice and aesthetic, more secure, more comfortable. Because realize that the way the setup was, I walk through sometimes and you'd see people sitting, not comfortable, not talking to them, but just watching the expression on their faces, you can deduce a lot of things from that. So with the hard work of Mr. Knight and staff, we were able to remodel the front office, and now we can say that we have an aesthetic area that is pleasant and more comfortable to clients.
Dr. Dublin noted that in addition to those successes, the Foundation was able to negotiate a $1 million loan from the Aid Bank. And that's the English segment of the news. We now join Marcus in St. Louis for the Creole highlights.
Allô tout le monde, bienvenue à cette nouvelle en créole. Non moins c'est Macpherson Saint-Louis. Premièrement, ministre agriculture tient une consultation aujourd'hui qui mettait attention à ces manières pour formuler un plan gourmet au compte Black Cigar Token. Plusieurs officiers agriculture attendaient consultation yon jour là qui prend place en hôtel Garaway en Wozo. Monsieur Ryan Ansem, c'est officier quarantaine, ministre agriculture.
July nane sala Black Cigar Token vini Dominique. Le ministre agriculture qui a fait tout bagay possible pour manager maladie ça là. Bon matin, ça qui a fait, c'est un national consultation dans le Black Cigar Token. Nous menons tout le monde, tout stakeholders ensemble pour nous garder plan nous. Nous ni assistance là au FAO. Ça FAO fait yo ba nous un consultant. Nous c'est Dr. Perez. Dr. Sala. Il travaille en Black Cigar Token pour 30 ans. Ils savent tout bagay contre Black Cigar Token. Et c'est expert là en la terre qui savent on partie contre Black Cigar Token. Aujourd'hui là, ça nous allons faire. Nous allons parler, nous allons discuter Black Cigar Token. Nous allons faire un plan. Il allons garder plan nous. Ministre agriculture allait présenter plan nous. Il allait ba nous un plan aussi. Nous allons discuter comment plan ça là allait aider Dominique gourmet contre Black Cigar Token.
En notre nouvelle, le gouvernement Dominique a bâti un bâtiment neuf pour State College Dominique. People's Republic of China ka assiste Dominique epi on loan epi lante web bien bas pour bâtir maison salam. Quand même si le ministère de l'Éducation, Honorable Peter Saint-Jean, étudiant Dominique Kenny on met environ taper éducation à eux.
Le gouvernement Dominique a dépensé un lot de millions de dollars pour développer le collège là. Parce que nous avons si Dominique ni pour développer, nous ni pour ni ça nous a créé un conducive environment. Ça c'est un environnement là même jeunes gens ça éduquer koyo yo ka senti libre et yo ni facilité et c'est pour raison ça là nous ka quoi qui nous pour ba yo c'est facilité qui rende yo pour faire bien. À présentement nous ka dépenser beaucoup de l'argent pour nous développer State College puisque nous ka quoi vraiment c'est ça qui détermine succès ces élèves-là qui sont en State College.
À notre nouvelle organisation Rotary Club Dominique, ensemble et puis ministre de la Santé, tient un workshop aujourd'hui qui mettait attention à ces manières pour traiter diabète, ça c'est Pissadou. Workshop ça là prend place en stadium Windsor Park en Wozo, qui était attendu par plusieurs participants. Quand même si le président Rotary Club Dominique Mervin Birmingham, il y a un officier qui a plusieurs expériences en traitement maladie là. Conduit workshop là.
Il y a pile monde Dominique qui a souffert de diabète et puis c'est pas les nous ka parler ba yo nous ka dire ce qui ça pour yo faire mais quand écouter ça nous ka dit et puis yo ka aller faire chemin yo et puis ou ka ouais les yo dévier à clinique là santé yo pas bien et puis yo pas ka faire bien. Et puis, un groupe international développer une stratégie, une initiative là, où il fait des toits, ça veut dire conversation map tools qui ont une nouvelle manière pour aider les gens à connaître condition là diabète et puis comment yo même ça indécoyo vivre plus long et puis plus meilleur.
Et puis finalement, chairman pour National Development Foundation of Dominica, Dr. Damian Dublin, bien concerné contre monde qui a porté l'argent au et puis pas qu'à payer vivre, ça ou créer délinquance. Dr. Dublin fait parole ça pendant yo te chain grand meeting à yo ça ou créer AGM à yo mercredi semaine ça. Et aussi mentionné comment yo ni plan pour plus gros business ça ou créer macro enterprises.
So, nous avons si vous venez pour l'autre et pour des problèmes, venez parler pour nous, nous comment nous sommes organisés pour chaque fois pour l'autre pour planter quelque chose et pour des problèmes. Ça fait, vous venez parler pour nous, pour organiser pour voir comment nous sommes baisser l'argent au payer tout le monde pour faire payer plus meilleur.
Messieurs, mesdames, ça c'est tout pour nouvelles en créole pour à présent. Non, moi c'est Macpherson St. Louis. Au revoir.
Up next, your tip of the day. Know your diet pitfalls. To improve your eating habits, you first have to know what's wrong with them. Write down everything you eat for 3 days. Then check your list according to the rest of these tips. Do you add a lot of butter, creamy sauces, or salad dressings? Rather than eliminating these foods, just cut back your portions. Are you getting enough fruits and vegetables? If not, you may be missing out on vital nutrients. And that's National Focus. As usual, we invite your suggestions or comments. Feel free to drop us an email at gis@dominica.gov.dm. You could also visit our website at news.gov.dm. You could also visit our GIS Dominica pages on YouTube and Facebook. On behalf of the entire news production team, I'm Mervin Matthew. Thanks for watching.